Good afternoon, everyone. I'm Nilton Nascimento, and I'm Director of the Center of Control and Monitorization. I would like to thank all speakers here present to accept the invitation to be a part of this event, to contribute through sharing ideas to continuing the digital transformation of health in Portugal. Regarding the subject today, the repository of complementary mix contributing the initiative of through constituting a centralized repository for all information with a result of the decision-making. This measure, inserted in the Plan of Recovery and Resilience, aims to create solutions throughout all the data from the exams to be treated in an integrated way, allowing to have more from them through the patients and the NHS. We have speakers with us, honorable speakers, that I will present now. Germano Sousa, Professor, Pathologist Medical, currently presiding the administration and clinical director of the group Germano Sousa, he was a co-founder, and Germano Sousa Health Centers. Throughout his career, he was director of a pathology service from Hospital and Desterro e Capuchos Hospital as well. He was also a bondsman from the health department. Rui Guimarães, specialist doctor in anesthesiology, president of the Central Hospital of Vila Nova de Gaia and Espinho. He was clinical director in Santa Maria Maior de Barcelos and also assistant of the hospital assistant of Braga Hospital. Member of the board of both anesthesiology throughout 9 years and coordinating of the internship medical facility. And lastly, Joaquim Cunha, engineer, degree in Engineer of Informatics degree, and currently has been involved in the construction process. Throughout his career, he's been dedicated to CASO, regarding associations of informatics, founded in '93, and since then he's been CEO. To start the sharing of opinion in this roundtable, I will launch a first question and I will ask each speaker to comment. Given the professional context in each of you, how do you position yourself regarding the construction of a central repository for all the data of diagnosis and therapy, in your opinion, and through the institutions you represent, what are the opportunities and challenges ahead? And I would start this talk with Dr. Rui Guimarães, and I will pass the floor to him. We have no sound. Thank you for the invitation to be here. And we have the ingredients for success. We have 2 doctors, 2 engineers to be able to take this further on. I would like to share a few difficulties that are part of the growth, normal growth of people. And I divide here 2 ideas. The issue of what is the dream and ambition of people to be able to imagine solution, and then the reality, what is making happening. And I bring an example. When I arrived at Barcelos Hospital, and I positioned myself as this child here, having a desire, a wish to arrive at the hospital. And when I arrived, we didn't have a tech machine. And fixating new doctors and be attractive to others. Not just that, we also had a resolution camera, a chemical one, for x-rays, and it was very farther apart from what is now digital. We need to be innovative, and we tried to launch a campaign to be gathering money to buy a tack machine for the hospital. Sometimes the ingenuity of a child is not the same as a grown-up, and so it's not just having a tack machine. We need to have a repository to organize images, and was my first difficulty, having a face-off. What we want is not exactly the reality of what we have. So we needed to find a solution. I was lucky and had the privilege of having, at the time, the north part of the country, Central health system, to include our hospital as a huge health center to have those images. And what was an obstacle to a goal, it transformed itself into an opportunity with an easy solution. And now it's how it works. And with this example, we launched this table, agreeing completely in the way to organize resources around what is best for the hospitals and for the patients. Another note, sometimes we have the idea that patients are lost in the system, and what's better would be to ask a new exam. So you're going to do a new one. And many times this has risks for the patient, not just in economic terms. And SPMS has a long way regarding dematerialization of exams and prescription. I think we are a country that is ambitious in terms of solution, and we need to step forward and be able to do it. There are other realities that are very close to us, like Azores, with hospitals connected, with the one repository of image, Ireland, that since 2008 has more than 27 hospitals connected to a single repository, being available, each part of the system connected, and then a great advantage to have to place in the hands between SIA and our patients, to place in the hands of the patients, our client, between brackets, the possibility to be owner of his own repository and be able to freely consult, not just this information circulating in parallel, but with him as a patient, as a co-owner of his own clinical process. And I would say our country has all the conditions to go from that phase to implementing and be able to overcome this challenge, and for us to be able together to work better. I have a few more things to show you, but maybe later. Thank you, Dr. Rui. Following the logic of the route of an exam, we will pass to the component of the companies. So, Joaquim Cunha, your comment regarding this subject? Thank you. First of all, to thank SPMS for the invitation, to the moderator and to my colleagues in the panel. It's a pleasure to be with you. Maybe, if you allow me, I will make a zoom regarding the line of the vision of the health cluster. We try to have an integrated vision regarding these subjects. And the one bringing us together, the data in health, is clearly, would almost say, the future, the challenge of the future, how we will deal, how we will see in the near future. So give you a few notes to framework. To the health cluster, and this is a strategic subject that comes from our vision. In an exercise that was done 2 years ago, no more, we tried to look strategically to the goal, and we reached 4 agendas. There are innovation, industrialization, digitalization, and data. 50% is in the line of what brings us today here. And the pandemic, and more than the pandemic, the recovery post-pandemic is reaffirming it. In that context, recently, we published a study that we named Plan of Development for Health, a vision for this recovery, a contribution for the recovery that the country is initiating or will initiate, where health will gain centrality. And in this plan of development for health, there's 5 key areas. One of them is the smart health. Once again, this subject is on the table. And then to give you a few notes on the set of initiative, dynamization of data way, the subject of the healthcare project, mobilizing in the area of smart health. In the same area, we had a network of associated people working in a platform regarding chronic disease. Once again, the astros are aligned, all this. And a note also for the European dynamic that is developing itself. We seek to participate in it, being one of the subscribers of the joint declaration, bearing in mind the creation of a space, European space of data regarding health data. We think the path is this, using the metaphor of the dream and the little boy that was presented earlier. I'm not a child, but I would like to be sometimes. I think we should all have a dream, a better Europe, a more united Europe, more cohesive, and probably the path will be health. One of them, to have a common policy in health in Europe. And if that happens, probably will happen through data, if we are able to create a space in Europe for data in health. And I will pass the floor now to my other colleague. Thank you. Thank you, Dr. Joaquim. I will pass the floor now to Professor Germano Sousa for him to give us his own opinion. Thank you for the invitation, and are my colleagues on the panel. And I would ask for a slide I brought. Is it possible to show the slide? I call this Searching Alliance Arc, the lost data in health. Why? Because in reality, it's crucial regarding to have an alliance between all of us working in health, between health system, hospitals. We need to create a common platform because data in health, there are a lot of them. And I would like to remind you that it's not just complemented means of diagnosis. It has to do with life science, the images53 the lab, etc. And note the growth. In 2017, we had 53 exabytes of data register. In 2020, we have 2,134 exabytes. And this is a growth. Exabytes are 92% of the health data of Europeans are away from the EU. In Amazon, and not just Amazon, and Google, and many other providers that we don't know where they are, and they are gathering more and more data. And they're very useful in terms of, it's key to understand that the future medicine is based on data, not just because we have 5G coming or because the elderly will be connected, but because those data in health, the more reach, the more information and knowledge we have for analytical and cognitive, better our patients will be treated. AI, deep learning, machine learning will allow this to be more possible, to improve velocity. But there could be a proactive management in the healthcare and therapeutical, precise and standardized. And these capabilities will be achieved through acquisition and automatic management of data, support to labs and systems based in image, remote access to medical information, access to medical database internationally. And I think this is very important. We are in a global world. Support through AI, the therapeutical and diagnosis through integration of all data in health for the patient, integration of administrative and clinical data, and that will allow a financial management that is adequate with cost reduction. The results and reports of the complementary means of diagnosis, namely labs, exam referring to each patient, are in several platforms or in no platform. The patient goes in. We need to understand that the patient, when he goes to the HNS, goes to the entire health system. And the data of the patient are not localized in one place only. It's crucial for the future. If we need to speak about the future, it cannot be just in data in this Portuguese national health system. The person that goes, it goes to the SCA, it goes to a private doctor, it goes to another hospital, and all those data are everywhere. There's no relationship between them. They're not related between them, and they're not related to the other clinical data, which is worse. And a clinical analysis or a radiological exam, if I don't know anything else from that patient, I have nothing. So to maintaining things as they are, it will give origin to high costs and lower expectation for the patients, repetition of exams, etc. I had that experience in various hospitals. I didn't allow my colleagues to ask other exams that have been done already. When I picked this hospital, because every week they were asking for new exams as we had the possibility for the patient to disappear from one day to the next. No, the machine was working like that. And this is a small example. There's a lot to be done. Not just having a platform for the national services. No, we need to know how to work it, how to integrate those results in those data. If we don't do anything else but this, we will have, it will not be an autistic SNS, but we need to have a system that is integrated for the patient. And that's why I said earlier, it's the arc of the alliance. We need an alliance where all the patient data are in one platform and everyone can, every doctor authorized can consult that data of his patient throughout his life cycle. Because if we do not do this, we will lose a lot. Thank you. Thank you, Dr. Germano. And I will place a question regarding following your presentation. In your opinion, do you think we are ready for this step forward to leave a decentralized model and advance to a centralized one? In your opinion, because you know better than no one, the private sector, we are not, in my opinion, we are not prepared yet, but we have to be. the issue of the private sector and the conventional center, we need to regulate for the patient. If not, we are not advancing. This is the future. The future of health is digital health, is health where every patient has every day. I debated this many times. It's one of our concerns, how to make the patient to be owner of his own data, and all data in health to be constituted in one folder only, to be consulted digitally, of course, electronically, by every doctor, if the patient allows it, or go beyond that. And once again, we are swimming in a pond, and we're not leaving that pond. It's having a platform for all the hospitals in one place. We need to think big. We need to move forward. This is the question. Dr. Joaquim, question for you. Having Health Cluster Portugal, many associates, how does this association can contribute to reach this goal with the knowledge you have, that all the associated with competence that can help not just the national health system, but other as well? How, in your opinion, how can this contribute to a good evolution? I will try to answer, maybe searching a few keywords. I believe the challenge here ahead regarding this subject of data in health has to do, in a way, as Professor Germano Sousa said, has to do with cooperation, and again, collaboration between academia, hospitals, companies, and public entities, private health professionals, between them and the citizens, institutions, regions, countries, all of us together. The example of the vaccine for COVID-19 is extraordinary, I think. It's extraordinary how humanity was able to, in less than 12 months, to develop, test, manufacture, and deploy a vaccine and inoculate the population. Normally, as you know, it takes 10, 12 years. What was needed? It was needed resources, yes, but mainly we had to have a vision, a strategy, a leadership, and we had to work together. In the Health Cluster Portugal, by induction, we have a lot of associates, yes, but we are not their boss. So it's not a holding giving directives to the associates. We can bring these subjects to the table and we can debate them. And we think that this subject of the data, not because we are here today speaking about it, it's really very important. There's a window of opportunity here, and health gained huge visibility throughout this pandemic. There's a positive way to look at it, we need to seize it, this part. The issue, Europe is looking at this closely. We know everything in Europe, things are slower, but there's a light at the end of the tunnel. And because in line of what I was saying, I admit that the answer to the great challenges ahead in research and management in healthcare is going to go through using intelligently the management of data. And to conclude, and there's the other side. There's also difficulties, and the difficulties, in my opinion, are two. Everything that is change or implies change is difficult. Energy consumed to do something is superior to the one that is to stay put. So we need activating energy. And then there's another point that is GDR. And I'm saying this not in a negative way. I think it makes sense to this regulation, but we need to know how to work it, how to understand it, and how to seize the opportunities, because this allows, brings two other keywords. It has to do with the patients and the citizens. Trust. It's important to not have breach of trust regarding these subjects. We have to have a pact between all the professional and the consumers that this is serious and that this will work, and we are committed to launch it. And if we go this way, I think we will have success. We need to seize the RGP, not as a limitation, but an advantage. Dr. Rui, going back to your presentation and everything that to a smaller dimension, not a national one, what were the key factors for the approach you did and to transform a limitation in an advantage? Because in this case, at the national level, it's also the same. We are walking the walk. And this is exactly it. I was hearing my colleagues, and changing is spends a lot more energy than staying put. And to us, a colleague, he was traveling on the other side of the world, and he has an accident, and he wants an opinion to know if they are proposing a good surgery, if he should take a plane and come back. So what he does is makes a picture with it, WhatsApp, and it sends it to a colleague. And for us, we are very fast. We forget regulations. We forget when we create solutions that are for us, interesting for us, they are easier to implement than for others. The example of the vaccine, we have a registration, electronic registration of the vaccine, and we know at the second, not just who is being inoculated, but georeferencing where the vaccination is taking place. So this is a great advantage in terms of country, in terms of health system, above other countries, independently if it's part of the national health system or not. Professor Germano said earlier, when we made this implementation, one of the things we had was a lot of exams outside the hospitals, and we created a norm to include also the conventional sector to use even those exams made outside the hospital. This idea of giving power to the patient, because the patients more and more reivindicate, they claim their own rights. And so the pandemic, I think, they created a great alert to understand that disease is not just in the community with the people that are sick. No, disease can hit anybody, including healthy people. And so people are more alert to these issues of health. Your question is how to make the change involving people and creating a pathway that is easier. In the Açorian case, they were able to connect all the archipelagos with all the hospitals with the same system, with the same repository. We have units that instead of using their own system to visualize their exam, they go immediately to the platform because it's quicker and more intuitive. They understood that is its advantage. And when we have the examples of Ireland with 27 hospitals connected, in less than 18 months, in Portugal, we don't need to be afraid of that evolution. We have people on the ground, people who are professional, thinking health independently of their positioning, and this table is a coincidence of this table is very happy one. We are speaking for the patients, independently from the typology of healthcare, whether it's public or private, and to understand that this is an asset for all. we don't need to be afraid to face the challenges ahead and overcome them. It's possible. If technologically it's possible, we don't need to be afraid. The example of our hospital center has 4 different areas. We have 4 physical facilities, and if we think about the difficulty, then we had to create 4 subunits. We already do this in our hospital centers. What is the difference to join with São João, with Santo Antônio? Because they're closer together and we can share immediately in terms of the images. It's the dream of all professionals in health profession. What moves the users is the factor that we have tools, intuitive and fast tools. We don't have the patience to go open another window and wait. And then if we give people easy tools, intuitive ones and easy ones, that's what people want. And in this time, in this subject of the repository of data, with a centralized view, I think this gives us a great advantage and we will be able to reach it. I'm optimistic and now with a little bit more experience because I made my own mistakes. I think we will be able to reach it, and we have all the conditions in place. We need to seize the opportunities given because finance investments, it's important, but also to see the assets, to see the gains that can arise from it. Even the ones having one's only entity reporting exams, for instance, because sometimes rentabilizing resources, we can save a lot. And so I understand, and I had a last question would be the right pathway, but regarding your opinion, has already been answered. This is the right pathway, independently from the difficulties. And a last question then. And I'm seizing the opportunity that I will be one of the people involved in creating this repository. What clues, what guidelines would you give us to reach the end of the line with this objective, with this goal that we want to implement and change the current paradigm, decentralizing and centralizing in one location only? It's a completely different paradigm for the information. What would be the source? That would be the keyword. Can we start with Dr. Rui? I think we need to be careful when we speak about a soul. It's a dangerous word because health lives around redundancies, and to have just one place, the system cannot stop. So even if we are concerned if there's going to be a cloud or a physical facility where all the data will be collected, we need to create rules for people to be indexed easily to the same system, and the systems to be able to communicate amongst themselves. And because we know that the market has several functions, so for everybody to use the same tailor suit is one of the handicaps to implement measures for the systems to communicate amongst themselves and for people to be connected in a reliable one, and to be concerned to create mechanisms of safety that allows people to understand that the system is robust. And from here, I would say that we are many times motivated with experience, pilot experience that work rapidly. And I would say that the northern region of the country that has already an advancement in the matter, because all our health centers are connected and hospitals to build as a starting point and to contaminate the rest, so to speak, with this solution. And so the pilot tests, they have this dimension of we are testing and we lower the difficulties for people in terms of demands and perfectionism that prevent us many times from reaching our goals. This will be my suggestion, going back to what I was saying earlier, involving everyone, involving users, the engineers, the doctors, the people who use it, because the solution indeed has to be possible and it needs to be easily accessible. Because if it can be practiced, then it will be impossible to stop it. Dr. Joaquim, your opinion, your final comment? We have no sound, Dr. Joaquim. We had to have a small difficulty. Okay, I was saying that I'll be brief and maybe I will summarize in one word: transparency. Transparency involving everyone, the process to be carried out or visible for everyone, because indeed this is a common interest. So just a reflection, final one. If we can freeze this conversation in 20 years from now, maybe we'll not be here, but if we revisit it, the same conversation, we will see how ridiculous being here debating this issue, because this is the pathway. I have no doubt that I'm not psychic, but there's no other way. We have to take this path, and transparency, ethics, all this set, they need to be present for the process to be strong, for having a commitment between all of us, health professionals, patients. Thank you. Dr. Germano, your opinion? Thank you. 2 words, very fast words. Going back to my idea that there needs to be a whole where everybody is implied and not just the health system. And we need to create it fast. Technically, no, I'm not going to tell you how to do it because you know better than me, but we need to have the will to do it. Political will. The politicians need to understand, those that are connected with health, they need to understand that this is crucial and it's the future. Without it, the health system maybe will not be able to work properly. So we need transparency, yes. Will to collaborate. Everybody needs to be called upon. Everybody needs to be gathered, private sector, public sector, and political will. We need to have the politicians understanding the importance that this can mean. Thank you. Thank you all. It's a shame that the session is so short, because we could go on talking about the subject, but it's part. I would like to thank all of you for being here, and thank you for your time. With the comments and the presentations that we will see, they will contribute to the evolution of this situation, and hopefully we will contribute with the collaboration of all. And in the future, we will debate it again, and maybe in 20 years' time, we will all be here to see the evolution. Thank you. And for those assisting the session with us, I hope you have liked it and continue with the event. Thank you. Good afternoon.